The next question is from Adam Muller with CBC News. La question suivante est de Alan Muller de CBC News.
Hi there. Yesterday we were told by the Federal Health Minister and yourself that the passenger that had traveled to Toronto did display some symptoms on the flight. Today we also heard from the Chief Medical Officer of Health in Ontario that the passenger was asymptomatic on the flight. And today you said that he displayed mild cough upon arriving at the airport. I'm just hoping you could clarify whether the passenger, who did in fact, was determined to be the first confirmed case in Canada, if they exhibited symptoms on the flight, or if it was only after arriving here that had happened.
Well, I think that obvious symptoms developed afterwards, but of course, out of an abundance of caution, we are, the Ontario Health Authorities will be doing plain contact tracing because as they went through the border, the first case reported some mild cough. But it sounds like there was really no obvious illness. So I would say that most of the symptoms really developed after entry, and then the appropriate measures were taken. But we didn't want to take any chances, so going back to the plane and looking at contact tracing with that 2-meter radius, I think is a reasonable and precautionary approach.
Thank you. The next question is from Steve Scherer with Reuters. La question suivante est de Steve Scherer de Reuters.
Hello, thank you. I wanted to ask about the people you were testing on the flight. Can you tell me how many people you were not testing, but you were trying to contact? Can you tell me how many people you've been able to contact that were on the same flight as the first case, and how many you still need to contact from that flight?
The responsibility for contact tracing is at the local level, and so really, I know they're working very hard to complete this contact tracing. So that's what's happening right now. So I can't comment on that.
Can you tell me what will happen to those people once they're contacted? Like, if they were to say, yes, I have flu symptoms or something, would they be immediately asked to quarantine themselves, or is there anything being asked of them?
Yeah. So the passengers on that same flight should have received information what to do if they get sick. And the scenario that should play out is that if they have symptoms, they will call ahead and tell the health provider that they've traveled and they have symptoms. But during contact tracing, again, if the local public health would ask if they have symptoms. And of course, if they did, the necessary infection control measures, isolation, etc., and contact tracing will then occur. Investigation of of anyone who's symptomatic. So the expectation will be any of the passengers who are deemed in that vicinity of the patient, if they have symptoms, they will be investigated.
They will be, sorry? I couldn't hear the last point.
They will be investigated in terms of, yeah.
Thank you.
Thank you. Merci. This concludes the question and answer session.